The medical conference in Boston's prestigious Massachusetts General Hospital fell into an uncomfortable silence. It was 2018, and physicians from around the world had gathered to discuss integrative medicine approaches. When Dr. Elena Santos, a Filipino physician specializing in ethnobotany, presented her research on traditional herbal treatments, the reaction was swift and brutal. "Witch doctor nonsense," declared Dr. Richard Morrison, one of America's most respected oncologists, his voice cutting through the auditorium. He stood up, his white coat practically glowing under the conference lights, embodying decades of Western medical authority. "You're presenting boiled leaves and crushed roots as legitimate medical treatment? At a scientific conference? This is an insult to modern medicine." The room erupted in murmurs. Dr. Morrison continued, pointing at her slides showing indigenous Filipino healers preparing herbal remedies. "These are superstitions, folk tales, placebo effects at best, dangerous quackery at worst. There's a reason we use FDA-approved pharmaceuticals, because they're tested, proven, and actually work." A British oncologist added from the audience, "Perhaps this is acceptable for minor ailments in rural villages, but we're discussing real medicine here. Cancer treatment, chronic disease management. You can't seriously suggest that grinding up jungle plants compares to chemotherapy developed by actual scientists." Dr. Santos stood quietly at the podium, her hands steady despite the assault. She had expected this. For years, Western medicine had dismissed traditional Filipino healing practices as primitive superstition, unworthy of scientific consideration. What these doctors didn't know was that she had spent 15 years documenting something that would shatter their certainty. "Dr. Morrison," she said calmly, "what if I told you I have a patient, a stage 4 pancreatic cancer patient, who was given 3 months to live by American doctors 5 years ago? He's still alive, tumor-free. Would you be interested in knowing what treatment he received?" Dr. Morrison laughed, but there was an edge to it now. "Impossible. Stage 4 pancreatic cancer has a 5-year survival rate of less than 3%. If such a case existed, it would be documented in every medical journal. Show me the peer-reviewed studies. Show me the clinical trials." Dr. Santos smiled. "I can do better than that, Dr. Morrison. I can introduce you to the patient and 37 others with similar results. I'm conducting a clinical trial right now in Manila, proper double-blind study, control groups, the full scientific method you respect. Come see for yourself, examine the patients, review the data. If I'm wrong, I'll withdraw my research. But if I'm right," she paused, "you'll need to reconsider what you call witch doctor nonsense." The challenge hung in the air like electricity. Dr. Morrison couldn't refuse without appearing afraid of the truth. "Fine," he said tersely. "I'll come. And when I prove these are either statistical anomalies, misdiagnoses, or outright fabrications, I expect a formal retraction and an apology to this entire medical community." 4 months later, Dr. Morrison and a team of 5 American physicians, 2 oncologists, an immunologist, a pharmacologist, and a research statistician, arrived at the University of Santo Tomas Hospital in Manila. They brought portable diagnostic equipment, medical record authentication specialists, and a deep conviction that they would expose medical fraud within days. Dr. Santos met them in the hospital lobby. "Welcome to Manila, doctors. I've arranged for you to meet the patients, review all medical records, conduct your own examinations, and analyze our treatment protocols. Complete transparency." The first patient was Carlos Mendoza, a 62-year-old man who had been diagnosed with stage 4 pancreatic cancer at Johns Hopkins in 2013. Dr. Morrison reviewed the original American medical records, confirmed pancreatic adenocarcinoma with liver metastases, prognosis of 3 to 6 months without aggressive treatment, perhaps 12 months with chemotherapy. "These records are authentic," confirmed Dr. Morrison's specialist after verification. Johns Hopkins official documents. The diagnosis was terminal. And yet, Dr. Santos said quietly, Mr. Mendoza is sitting in our waiting room right now, 5 years later. Would you like to examine him? Carlos Mendoza walked in looking healthier than most 62-year-olds. Dr. Morrison conducted a thorough examination, then ordered a complete CT scan, MRI, and comprehensive blood work using the American team's own equipment to prevent any possibility of tampering. The results came back that evening. Dr. Morrison stared at the scans in silence. No tumors, no metastases. Blood markers completely normal. It was as if the cancer had never existed. What treatment did he receive? Dr. Morrison asked quietly, his earlier arrogance beginning to crack. A combination of 3 indigenous plants, Dr. Santos explained. Banaba leaves, tawas powder, and an extract from the bark of a tree we call balete. Prepared according to traditional methods passed down for generations, but administered under controlled medical supervision with proper dosing. That's impossible, insisted Dr. Morrison. Plants don't cure stage 4 cancer. There must be another explanation. Then examine patient 2, Dr. Santos said calmly. Over the next week, Dr. Morrison and his team examined 38 patients. Each had been diagnosed with terminal or late-stage cancers by Western hospitals: pancreatic, liver, lung, colon. Each had been given months to live. Each had declined conventional treatment, and each was now in complete remission after receiving traditional Filipino herbal protocols. Dr. Morrison's pharmacologist began analyzing the herbal compounds in the hospital laboratory. What she found shocked her. Richard, you need to see this. These plant extracts contain compounds we've never isolated before. This one from the bolete bark. It's demonstrating selective cytotoxicity against cancer cells in vitro. It's killing cancer cells while leaving healthy cells untouched. That's exactly what we've been trying to achieve with targeted chemotherapy for decades. The immunologist made another discovery. The banaba leaf extract is modulating the immune system in ways I've never seen. It's upregulating natural killer cell activity by over 300%. It's essentially teaching the patient's own immune system to recognize and destroy cancer cells. Dr. Morrison spent 3 sleepless nights reviewing data. Everything he had built his career on, his certainty about pharmaceutical superiority, his dismissal of traditional medicine, his conviction that Western science had all the answers, was collapsing under the weight of undeniable evidence. On day 8, something happened that completed his transformation. A new patient arrived at the hospital, an American businessman working in Manila, recently diagnosed with stage 3 colon cancer at Massachusetts General, ironically, the same hospital where Dr. Morrison worked. The man had heard about Dr. Santos's work and wanted to try the herbal treatment. Dr. Morrison examined him thoroughly. The cancer was real, aggressive, and would require immediate intervention. "I can arrange for you to fly back to Boston," Dr. Morrison told him. "We have excellent oncologists, cutting-edge chemotherapy protocols." The patient shook his head. "Dr. Morrison, I've seen your success rates. 30% 5-year survival for stage 3 colon cancer with conventional treatment. Dr. Santos is showing 75% complete remission rates. I'm staying here." Dr. Morrison realized the man was right. The data didn't lie. These primitive herbal treatments were outperforming modern chemotherapy by nearly every metric. Higher remission rates, virtually no side effects, significantly better quality of life during treatment, and a fraction of the cost. He found Dr. Santos in her laboratory, carefully preparing herbal extracts using methods that looked ancient but were executed with scientific precision. "I don't understand," he admitted quietly. "How did we miss this? How did modern medicine overlook something so effective?" Dr. Santos looked up from her work. "You didn't overlook it, Dr. Morrison. You dismissed it. There's a difference. Western medicine assumed that if something wasn't developed in a laboratory, it couldn't be sophisticated. But indigenous healers have been conducting observational trials for centuries. They just didn't call it science." She showed him her research documentation, 15 years of careful study, tracking traditional healers' methods, identifying which plants were used for which conditions, isolating active compounds, establishing proper dosing, conducting safety trials. "I'm not rejecting Western medicine," she explained. "I'm integrating traditional knowledge with modern scientific methodology. The plants are traditional. The rigorous testing is modern. Both are necessary." Dr. Morrison spent another month in Manila, learning the preparation methods, studying the traditional diagnostic techniques that helped healers identify which patients would respond to which treatments, understanding the holistic approach that treated not just the disease, but the patient's entire physiological and psychological state. When he returned to Boston, Dr. Morrison did something that shocked the American medical community. He published a comprehensive paper in the New England Journal of Medicine titled "Reconsidering Traditional Medicine: Evidence for Therapeutic Efficacy of Philippine Indigenous Herbal Protocols in Advanced Cancer Treatment." The paper detailed every case, included comprehensive data analysis, and made a stunning recommendation. Major clinical trials should be immediately conducted on these traditional Filipino herbal treatments. He admitted his initial dismissal was based on cultural bias, not scientific evidence. The medical community erupted. Some colleagues accused him of being duped. Others suggested he had lost his objectivity. But Dr. Morrison's reputation for rigorous scientific integrity was unimpeachable. The data was too strong to ignore. Within 6 months, the National Cancer Institute approved funding for the largest clinical trial of traditional herbal medicine ever conducted. Research teams from Harvard, Stanford, and Johns Hopkins traveled to the Philippines to study under Filipino healers and ethnobotanists. Pharmaceutical companies began investigating the active compounds in the traditional plants. Dr. Santos was invited to present at medical conferences worldwide. Her clinic in Manila became an international training center where Western doctors came to learn traditional Filipino healing methods. The witch doctor nonsense Dr. Morrison had once mocked was now being taught in medical schools alongside conventional pharmacology. Today, 3 of the compounds isolated from the traditional Filipino herbal treatments are in phase 3 clinical trials by major pharmaceutical companies. 2 have already shown better outcomes than existing chemotherapy drugs with significantly fewer side effects. The plants once dismissed as superstition are on track to become the next generation of cancer therapeutics. But perhaps the most profound change happened in Dr. Morrison himself. He now teaches a course at Harvard Medical School called Medical Humility: What Indigenous Healers Can Teach Modern Physicians. On the first day of class, he shows his students a photograph of a Filipino healer preparing herbal medicine and tells them about the day he called it witch doctor nonsense. "I was wrong," he tells them plainly. "Not because the science was bad, but because I assumed only Western approaches could be scientific. I learned that traditional healers are some of the world's oldest medical researchers. They just didn't publish in journals we recognized. Don't make my mistake. Listen to traditional knowledge. Test it rigorously. Some will be superstition, but some will be the medical breakthroughs we've been searching for." Dr. Santos continues her work in Manila, training the next generation of physicians in integrated medicine, combining the best of traditional Filipino healing wisdom with modern scientific methodology. When asked about Dr. Morrison's transformation, she smiles. "He didn't change because I proved him wrong," she says. "He changed because the patients proved me right. Sometimes the best teacher isn't a person, it's undeniable results." The plants still grow in the Philippine forests, as they have for millennia. But now, instead of being dismissed as primitive superstition, they're recognized as sophisticated medicine developed through centuries of careful observation. And somewhere in Boston, a humble doctor teaches his students that the most important thing in medicine isn't always knowing the answer. It's having the humility to recognize when someone else does.